Hey everyone, so for those of you who don't know me, my name is Ginger, and I am the instructor that teaches the kinesiology for dance in the winter semester. So I should hopefully be seeing some of you guys next semester. I am also a physical therapist like Kristen, but I work in the home health field, meaning people who are kind of trapped in their homes for mobility or other medical issues. I go to their home to see them. I also got my degree in dance from the University of Michigan, so I have been right where you guys are. I graduated in 2012 from that program with my BFA. Additionally, I also own my own business where I, again, travel to people's homes to do more of outpatient physical therapy. You can check me out on Facebook if you're interested at Divergent Physical Therapy and Wellness. Anyway, let's proceed with today's lecture. Today we are looking at different body tissues, both through a dissection demonstration and via self-palpation. If you have a friend or roommate that you guys feel comfortable coming in contact with each other, make sure, of course, you wash your hands, wear masks if you need to around each other, but someone that you feel comfortable with coming in physical contact with that you see on a regular basis and is not at risk for being COVID positive, feel free to use them. Obviously always asking permission, but if you don't feel comfortable with that at this time, just go ahead and palpate on yourself. All the body areas that we're going to look at today, I have specifically chosen as areas that you should be able to get to on your own. So without further ado, let's head right into our chicken lecture, and or the demonstration. I apologize in advance for how boring my voice is. Trying to pay attention to the chicken in front of me, whether or not things are on camera, and which body parts I'm looking at what time, lends for my voice to turn into a robot. So bear with me throughout. All right, let's head into the lecture. The objective for today's lecture is to explore different body tissue textures, learn some palpation skills, and be able to identify various body tissues through palpation. During the dissection of the chicken, I will be showing you different body tissues, including muscle, fascia, tendon, joint, capsule, cartilage, ligament, bone, blood vessels, and nerve. And we'll go into more detail on these in the next slides. So the first body tissue that we will be focusing on today, once we get past the skin, is your fascia. So your fascia is a connective tissue. It surrounds all of our muscles, blood vessels, nerves, organs, etc. So there's never an area of the body where it doesn't cover. So it's continuous through the whole body, which is why if you've got an issue with fascia somewhere in your body, either a restriction, an irritation, something along those lines, it can affect more than just the area that it is injured or restricted. It can affect all other parts of the body, especially, joints or body areas that are right nearby. So it's generally considered non-contractile, though there is some debate about whether or not it is able to actually contract. It is generally used as a support system for our body, so it holds up all of our organs, it wraps all of our muscles to give them shape and definition, and allow them to do their function. So a support system. It can be thick or thin depending on the region of the body, so you'll see as I'm going through the chicken, some areas you'll notice that it's a little thinner and other areas where it's nice and thick. Where it's in those kind of thicker areas, it can be pretty fibrous. So think of like your IT band, especially those of you that feel like you've got quote unquote tight IT bands. That would be an area where your fascia is thicker. All right, so let's get started. You can get your own, if you want to follow along, your own full chicken. You could also just do a drumstick if you're not interested in purchasing a whole chicken. Last year when I purchased a chicken, it was about $5-6 for the full thing. This year, I think because of pandemic reasons, this was more around like $12 or $13 for the whole thing. But anyway, we'll get started. So I've got my knife. You can use a big knife like this if you want to, or a smaller one if you want to be more careful about cutting yourself. But I'm used to using this big one, so that's what I'm going to work with. So you'll see first when you buy a chicken whole like this, it still has the skin on it. And you'll be able to tell that it's the skin because it's got all those nice bumps in it where the feathers used to be. So we're going to go ahead and remove that so that we can get down to the meat and potatoes of this thing. So I'm going to give it a slice. And as I'm peeling it away, you'll notice there's a little bit of kind of a clearish connective tissue that's underneath it. That is some of our fascia. So one of the first things we'll be talking about. And you'll see too where it's kind of connected, just this thin little strip. That's more fascia. And again, you can kind of see some right up in here as I'm peeling this back. So our fascia is that nice connective tissue. It surrounds all of our muscles, our nerves, our blood vessels, all of our major organs. And you'll see again some fascia. So it kind of looks a little bit like a web. Let me see if I can zoom in on that a little more. So it's kind of like a little web that's right up in there. And some of it just kind of broke. You can see a little bit of that web over here as well. So that is your fascia. So in certain areas of your body, it's more fragile than you would think. And then in other areas of our body, it can be really thick. So think of like your IT band. Okay. So I'm also going to cut away the skin on this side of my chicken. Being careful because I am not left-handed, and I'd like you guys to still be able to see. So again, we've got some of that nice fascia here. It's a little bit see-through, but it's that nice connective tissue connecting the skin onto our muscles. And again, I'm not left-handed, so we're going to try to switch this around a little. You are also welcome to tear. It is a dissection technique to tear, so feel free to just use your hands and not a knife if you are worried about cutting yourself again. So I've cut it back a little bit, and again we've got more of that nice fascia connective tissue there. I'm going to go ahead and tear some back, and you can see all that nice connective tissue fascia right in through there. Okay, so now we've peeled that away. The next area, just beyond the fascia that's underneath the skin, that we'll be focusing on are your muscles. So muscle fibers are made up of long, thin muscle cells. There are pairs of protein chains that are grouped into bundles, and those bundles are grouped into other bundles, which are grouped into other bundles and kind of make up your muscle cells, these muscle fibers. Your muscles are highly contractile, meaning that they contract, as we know that they do, and that they're very elastic. They have the ability to stretch. When you're during the dissection and as you're kind of feeling your own muscles, and or if you've decided to do the dissection with me, you'll notice that the muscles are soft, where you can kind of squish them a little bit, but they're firm, so you can't just put your fingers through them. So soft but firm. Okay, so the next tissue that we're going to kind of look at is the muscle. This is one that we're a lot more familiar with, but you can tell it's kind of that like soft but firm, kind of squishy area. On animals, it's, you know, once you've opened them up, you can see it's usually a little bit more on the pink side or the red side, depending on the particular animal that you're working with. And then we're going to go ahead and cut away some of our extra stuff. So the stuff that's right down the middle here, which is not something we're really going to be talking much about today, but that kind of yellowy, kind of squishy stuff is fat. So he's got a nice line of fat right down the middle of his breast area. And you can see some of it as well connected like to your skin and over here. So that's fat. Right in through there. And you'll see it, I've got fat right down there, and that just kind of peels right away. Okay, so now I like taking a look at the rib cage, which is down underneath our breast here. So I'm going to cut away part of our breast, and then we'll get right into the rib cage. One full breast sliced off there. And again, right here we've got a little rim of fat on the edge. You can see our fascia, that nice thin little layer. And that's in through the one of our breasts. Okay, so I'm going to set this off to the side. Okay. So we can't quite see the rib cage yet, but I can definitely feel it right in through there. I'm going to go ahead and slice my other breast off. Now that I've taken both of the breasts off, I'm just going to clean it up a little bit so that we can see a little bit better. We'll be opening it up in a minute. Okay, I've cleaned it up a little bit. It's still really hard to see, so I'm going to go ahead and just cut right into the bone area. So this is his sternum here, and you can feel it kind of poking upward, and then you've got the kind of ribs around it as well. So I'm going to go ahead and cut through, just not straight down the middle of the sternum, because that's going to be a really thick area of bone, but kind of off to the side. And it might not sound fun as you're cutting through kind of that area. We're going to go ahead and pull it open. Be careful, that bone can be a little bit sharp. And again, doesn't sound like a fun noise. But now you can kind of see down inside. So again, these are our ribs in the back. So your ribs run all the way from the front of your body to the back of your body, especially up towards your upper ribs. Toward the bottom ribs, they start to not wrap all the way around quite the same. But you can kind of see down into those little ribs and you can feel them. They're thin, but they're nice and hard and firm, and you can kind of see into the side of the sternum a little bit there. The other really nice part, and let me adjust my chicken to show you, is that you can see inside of the front of the sternum. So that's his sternum right there. But you'll notice an area of thick fascia. It looks kind of like shiny white right down in here between your sternum and the little rib right next to it. There's that kind of thicker area of fascia. So I'm going to try to zoom in on that one as well. So again, you've got your sternum right here. It's nice and hard. And then right next to it is that area of fascia. You can see my finger underneath, kind of rubbing in there. And you can kind of flex it around a little bit. But it's fascia, it's connective tissue. It kind of is a nice webbing between your ribs and your sternum. So that's another kind of nice area of fascia that you can see. Next, we will look at bone. We're all pretty familiar with bone, but I demonstrated how hard it was, that you could tap right on it, and it is unbending. So bone is made up of cells that create bone, as well as red blood cells, and it's made up of calcium as well, which gives it its structure. Specifically looking at long bones are, for example, your femur, your tibia, your humerus. So they're the ones that we think of when we think of bones. They're made of a hard, dense, but still porous kind of exterior. As you move further in toward the center of the bone, you'll find a soft or more porous inside. And then there is an opening down the length of the bone, or it's a hollow area. where your bone marrow is found, and your bone marrow is nice and soft. So the outside is nice and hard, and as you get towards the center, it becomes softer. And you'll notice too in the picture there is a lot of vascularity. You have veins and arteries that go to your bone. Unlike with your ligaments and your tendons and cartilage, you have much less vascularity to those types of areas, which is why when we break a bone, we swell quite a bit. When we tear an ACL, we'll get some swelling, but not quite as much as a broken bone. And when you tear cartilage, like your meniscus, you can have very little swelling because there isn't the vascularity to bring the swelling to the area. The next area that we will look at, the next body tissue, is a tendon, your tendons. So a tendon, different than a ligament, it connects your muscle to your bone. So if you look at either pictures online or if you look at the chicken, if you've decided to follow along with the dissection, you will notice that the tendons almost kind of grow out of the muscle. They are very interconnected, so it's hard to truly and cleanly separate the two. So your tendon is elastic with only a minor contractile ability. So your muscle is the thing that contracts. Your tendon then allows for some stretch and some movement, but it doesn't contract a whole lot. It is fibrous, made up of collagen and elastin, and you don't necessarily need to remember what each and every body structure tissue is made of, just kind of their properties. The tendons are used as a pulley system and used to kind of transfer muscle forces to bone. When you're doing the dissection, or as you're able to palpate later some of your tendons, you'll notice that they're pretty stiff. They're fibrous and they're stiff. So they have some elasticity to them, but not as much as your muscle, and they aren't able to contract nearly as much as your muscle. So we talked about muscle, we talked about fascia. Now we're going to look for some tendon. And again, as you see me pull on the skin here, you'll see more of that nice fascia up under here, kind of weaving in and around everything. It's a really nice, huge piece of fascia, and see how it's pretty clear, pretty see-through, and pretty easy to tear through that area. So that's a thinner area of fascia. But we can kind of peel back and take a look at the thigh and the drumstick area. We are looking for tendons. So for me, the easiest approach here, I'll peel back some more skin, till we get to a nice, really visible tendon, is going to be to take our drumstick off. So you can see this is the thigh, and you'll see those nice kind of striation of the muscle headed this way. And then my drumstick starts here. So we're going to cut right into the middle of that. I'm going to take a little more skin off first so that I can really get into what I'm doing here. And kind of right where those two come together, where there's a little joint, you can feel it by palpating. Okay. That would be kind of the equivalent of our knee. We're going to cut right down in through there. And again, not a super fun noise, but I cut partway through, and we're going to try breaking that open. So now you can see down inside of his knee. So we will kind of come back to this and talk about it a little bit, but we're going to, we've opened that up. I'm going to take some more skin off the bottom of our drumstick. And as I peel it away down towards where the ankle would be, so think about one of our thickest tendons is our Achilles tendon. That's kind of what we're hunting for on our chicken. And you'll notice, so there's some fascia on top of this muscle here, but you'll notice it gets whiter as it gets to the bottom. And that's where we see the tendon, where it attaches down to the bone. And again, Tendon attaches muscle to bone versus a ligament, which connects bone to bone. I'm going to give just a little cut on the side here. Not a very deep one. There we go, just to get through some of the fascia. So the fascia is a little thicker here. I have to kind of work to get down underneath that. But once I kind of open it up a little, again, you could see the nice striation of the muscle right in through there. And there is another tendon attached to a much smaller muscle belly. Muscle belly and tendon. And you can see that right there. Okay, if I keep tearing away at our fascia here, you can see even more little muscle belly and tendon. And more tendons coming in through there that operate the chicken's foot and ankle. Yeah, and again, we're surrounded by that nice layer of fascia that you have to kind of dig away at. But there's another nice muscle belly and tendon right in there, that nice shiny white. So your tendons, you'll find that you can kind of pick up pretty easy and pull on a little bit, and they're not going anywhere unless you pull really hard. So you can put a decent amount of tension behind it. And that's one way that you'll know that you have hit a tendon. The joint capsule is next, and really because of the function of a joint capsule, it's not going to be very visible when I'm doing the chicken dissection. So we'll talk about it, but you might not be able to really truly see it. So your joint capsule is a combination of fascia, ligament, cartilage, and fluid that sort of create a bubble around your synovial joints. Those are all your big moving joints, your elbow, your knee, your wrist, your ankle. All of our kind of big moving joints are called synovial joints. And you can kind of see in the picture that the different layers of tissue, and then in the center there you've got your synovial fluid that's in the joint cavity. Once the joint has kind of been opened up or exposed to look at, a lot of that tissue has been kind of obliterated, it's been destroyed, and the fluid will have leaked out. So again, as we open up a joint, you're not going to be able to truly see what the joint capsule looks like because you will have destroyed most of it. And the liquid will disappear. So it's really difficult to visualize, hence the fact that I did not spend a lot of time on it in the chicken dissection. Once we have opened up our joint, you will see again in the chicken dissection some different types of cartilage. So there are multiple kinds of cartilage. The big ones that you really need to know about, there is cartilage that are on the ends of your bones where a joint comes together. This is involved in the sliding or gliding of your joints on each other, so it kind of supplies it with a little bit of a slippery surface. There's another type of cartilage that's within the joint, between the two bones, and this is the part that gives your joints cushion, so that would be your meniscus in your knee. And then you've got other areas where cartilage is actually in place of your bone, so rather than having a bone there, you have cartilage. This is used for different body parts that require additional movement or flexibility. So some common areas that you can think of is your nose, the cartilage of your nose, the cartilage of your ears, and then actually of your rib cage. Portions of the lower part of your rib cage are cartilage rather than bone. Kind of that middle portion in the front of your body is made of cartilage instead of bone, and that allows for that flexibility that we need when we're breathing and moving around and doing things. Cartilage can have different textures based on the type of cartilage that you're dealing with. So the type that is sitting on the ends of the bones, it's quite thin, or can be quite thin, and it's slippery, and it almost feels like it's part of the bone. Then you have your cartilage, which I think feels a little bit more like a really thickened jello. Again, it's pretty slippery, but it's firm and hard to, you'd have to really take two hands to be able to rip it or tear it, and or might need a knife. So again, like kind of a thickened jello sensation. Okay, so now that we've looked at our tendons, and you'll see the one up at the top end of the muscle here, let's head back up to our knee and look at some different types of cartilage. So because I've cut into the knee, I've already kind of destroyed the connective tissue that held together that joint capsule. And you'll be able to feel, if you feel right on the bone, so that's the bone, but it's kind of slippery, a little bit slimy. That is actually one type of cartilage, so that's the kind that gives more of a lubrication. Versus, if I can find it in here, the other type of cartilage, which is more of a cushion, would be our meniscus. That's down in our knee. Right here you will notice a little fat pad that also assists with some cushioning around the knee. So that's just a little fat pad that sits there. So it's okay to have fat on our body, especially in certain areas, to try to cushion some of our movements. So that's a useful fat pad. So I went ahead and cut open our other side. We're kind of searching for our meniscus here, and I may have just cut through it on our first side. So we're now on the other side of our chicken, and you will notice, if I can get down, get a good view in here. So again, we're looking at essentially the chicken's knee. I cut through a little bit of bone here, so if you look down in it, you can see that kind of softer area that's down in there. Let me zoom again. So you should be able to see, again, if I slice through that bone, the little bit of softer area down in there. Okay. Then if we flip it around and look at the bottom of our knee, again we have that nice fat pad that helps cushion the patella and around the knee. But then you'll see this little flap that kind of moves right there. That is a meniscus. And if you feel it, so you don't want to cut all the way right down the middle of your the knee joint if you want to be able to see this one really well. But you'll see it's connected with some different connective tissue up in there. But it's got a different texture than the stuff around it, so it feels kind of more like a hardened area, but it slides around on top of the bone. And let me see if I can cut away a little. Okay, so now you can see I've fully detached it on the one end. But that is the meniscus. It's kind of rounded, and it's a little more firm. I like to think of it as like really, really, really firmed Jello. But that's the kind that's used for cushioning. And that's your meniscus right there. So you can kind of poke at it and feel the difference in texture between that and your ligament, and that and the other kind of cartilage that's more of just like a slippery coating. And that's our chicken meniscus. Continuing to look at the insides of our joints or around our joints, you will find ligaments. Again, the difference between a ligament and a tendon. A tendon connects muscle to bone. A ligament connects bone to bone. Ligaments are meant to provide stability to your joints. Therefore, they are made of a fibrous, non-contractile, so they don't do any contracting, tissue that has very little elasticity. So they're not meant to stretch a whole lot. They're meant to provide that stability. Therefore, they're much more stiff even than a tendon. As you're going through the dissection, if you have chosen to follow along, you will find that the ligaments are pretty strong and they're really difficult to tear or cut by hand. You really need a knife or something to kind of cut through them or to tear them away from the bone. But they're really hard to kind of cut right down the center or to tear right down the center with your bare hands. Some examples of some ligaments are your ACL, which most people have heard of. which is your anterior cruciate ligament. It resides in your knee, kind of deep down inside the knee, and you'll be able to see it in the picture here. In the meantime, though, you'll see this other white piece that's connected to the bone here. And the other end of it, let's get this little piece out of the way. Okay. The other end of it is connected to the bone on the other side. So thinking this is the same as our femur, this is the same as our tibia. This little white piece here is connected between those two. You can see right there, it's connected from bone to bone. So that is our ligament. And again, it's pretty nice and white and shiny, and difficult if you put a lot of pressure on it. It's difficult to tear. And we'll kind of keep looking for, you can see the one on the other side. So our medial collateral ligament and our lateral collateral ligament. On this particular bird, I've already gotten rid of, it looks like the ACL and PCL. Some of the harder structures to sort of palpate within the chicken and within the body a little bit can be your blood vessels. So we've got arteries and we've got veins. They're going to look kind of similar in the body, but they'll have a little bit different texture to them. So your arteries pump blood away from the heart. And because they have kind of a pumping action to them to try to get the blood away from the heart, the wall of the artery is a bit thicker and it is able to contract as well. So it's a thicker wall and it's kind of springy feeling. So if you're able to find a blood vessel as you are following along in the chicken dissection, you should be able to kind of squish it flat, and then it should spring back up a little bit. If you're to find a vein, veins return blood to the heart. They have a thinner wall. They're much easier to compress. They might not spring back as well. But the way that veins work is through valves, less so with the contraction of the vessel itself. So that's why there's a difference a little bit between an artery and a vein and their structure. But you can visualize them pretty easily in your chicken because they are a little bit darker, which I will show you. The last structure that we are going to look at in our chicken is our nerves. So these are hugely important, obviously, because they send all the signals from our brain down to our body. They are larger than you think, particularly our sciatic nerve. It's about the size of a quarter in diameter, running right through kind of the center of your buttock. There is very little elasticity in your nerves. They can stretch a little bit, but not a ton. So when you overstretch certain things, sometimes you can put a little extra tension on your nerve and cause some irritation. So that's why you need to proceed with caution if you're going to try to stretch a nerve. Better to mobilize a nerve than to aggressively stretch it. These nerves are made up of axons of nerve cells. They look and feel, while you're doing your dissection, sort of like cooked linguine. So they will look pretty similar to your blood vessels, except that they won't have any blood in them. And that they don't kind of squish down and bounce back. They stay flat and they're a little bit thicker. They are much harder to tear than the blood vessels as well. But easier to tear through by hand than, say, a tendon or a ligament. You can find large networks of these nerves around your armpits or around your groin, as this is where the big bundles come out of our spine and head into our arms and legs. So when you're looking at your chicken and you're trying to find where a nerve might be, I showed some examples, particularly up around the wings or the armpits of the chicken. But if you want to do some more searching on your own, if you look around the armpits and the groin area, you're more likely to find some bigger, thicker nerves to take a look at. Okay, so as far as blood vessels are concerned, you can find them a lot easier on the chicken because they are a different color. So if you look right in there, you'll see that kind of dark line. that is a blood vessel. Fun part about blood vessels is they are harder to tear, or easier to tear, sorry, than some of the other structures we've looked at today, so you have to be kind of careful with them. But you can, it's just like a hollow tube, so you can kind of squish them to be able to tell. Now a vein will be easier to squish than an artery, but you can kind of give it a squish and feel. It's a pretty thin, thin tissue on the outside, which is why it's pretty easy to tear. I'll flip my bird over here. Try to see if I can show it to you a little bit closer. Okay, so there's our blood vessel. You can tell because there's our blood vessel. You can tell because there's a little bit of blood still inside of there. And again, like I said, you can kind of take it and squish it, but they're pretty easy, pretty flimsy, and easy to tear right through. So that is our blood vessel. Okay, right next to it, you've got another tissue that again is it's mostly white, but it is not connected from muscle to muscle or from bone to bone, and it's pretty long. And a lot of times you will find blood vessels that run the length of these, but it is a nerve. The difference being that these are flatter. Your blood vessels, you know, they're hollow on the inside. Your nerve is not. Your nerve is solid, but it's kind of a little bit flatter like linguine. And it's got a little bit more, it's a little bit harder to tear than your blood vessel. Your blood vessel you can kind of rip right through. This one you can put a little bit of tension on. But like I said, it's not connecting. Ligaments are usually fairly short and they're connecting bone to bone. This guy seems to be kind of trailing off on his own somewhere up through the leg and up into the thigh. So that is our nerve right there next to our blood vessel, which again is right here because there's a little blood traveling through him. So they look very similar just from the outset, but you can see the blood that kind of travels in and out of this one, and you can kind of squish it a little bit. This one is taut and hard to tear and isn't really going anywhere in particular. So the other way that you can look for nerves and blood vessels often is by going up into the armpit or the groin. So there's another blood vessel up in there. If you go up to the armpit and the groin, there are large areas of nerves, large bundles of nerves that you should be able to find. I think in birds it's a little easier to find up around the wing, which is equivalent to our arm. So if I head up toward the wing, and again you'll see some of that kind of shiny area that is tendon. And if we go right into the armpit area, we should find some more blood vessels. So you can see those little red lines are blood vessels. And then we should also find some nerves in here. Another blood vessel right there. Here's another tendon. It's attached, the muscle's kind of running right into it, so there's another tendon. And another big tendon right in through here. Again, we're connected right in with our muscle. Okay, so I opened up the wing on the other side to look for another vein. So that was a blood vessel right here. that kind of fell apart pretty easily. But right next to him, that right there is a nerve, right down in what would be our chicken's armpit area. You can see that nerve running right through there. And again, like I said, it's not really, doesn't seem to be attaching from bone to bone per se. And it looks like it's still diving down through the rest of the that bird's wing and kind of down into the rest of the body there. So that right there is a nerve, and you can put a decent amount of tension on it. I just broke it, but more so than your blood vessels. Blood vessels kind of fall apart really quick. So now that we have dissected our chicken, you can feel free to keep exploring a little bit. You can even look from the back side if you'd like to. And I highly recommend, if you are a meat eater, to finish the job, clean it up, take all the skin off, you know, and cut all the different parts. You know, if you don't like to eat it off the bone, you can take the meat off and then cook it up for dinner. And I will show you guys how to cook the chicken breasts later. So now that you guys have watched the chicken dissection demonstration, we're going to be going into some palpation. So we're going to palpate different areas of our body, looking specifically at what the different textures and the feel of different body tissues feel like. So I've organized it in a way where we're going to go body tissue by body tissue. So I'll probably be moving all over the body. I'm going to try to get through this as quickly as possible, but may need to adjust the camera as I go. So bear with me again. So let's start first with bone, because this is the easiest, one of the easiest things to palpate in certain areas. So we're going to start with that. I also like to start with the bone because it gives us landmarks to find some of our other body tissues. So starting with bone, we're going to start from down by our feet and work our way up. Okay, so starting down at our feet, we're going to be taking a look at your medial and lateral malleoli. Now, I know you guys may not have talked super in-depth or may have just gotten into learning medial and lateral, but medial would be the inside and lateral would be the outside. Your malleoli are the very ends of your tibia and your fibula down at your ankle, and they're pretty easy to palpate. They are the bony, kind of what you think of as your ankle bones, bony protuberances on either side of your ankle. So you can feel those pretty easily. The next part that we're going to palpate is actually your talar head, so the head of your talus. So the reason why we use, again, those bony landmarks is because then it helps us find other bony landmarks. So if you find your lateral malleolus, your medial malleolus, you're going to go like dead center between those two. And I like to pinch my fingers kind of like this, right in the front of your ankle, in front of your medial and lateral malleoli. So not right at them, but in front of them. And then you're going to pronate and supinate your ankle, and you'll be able to feel a little bone kind of poke into your thumb and finger. And that is your talar head, which is important when we think about alignment, where our talar head sits inside of the mortise of our ankle. So again, you're feeling your medial and lateral malleoli come out in front of them, so you're in this kind of pinched shape, and then you can pronate and supinate and feel that bone kind of poke into your fingers, and that is your talar head. Okay, moving up the body somewhat, we're now going to take a look around our knee. So you've got your tibia is the big bone that's in the bottom part of your leg, and your femur. On your tibia, below your kneecap, below your patella, you should find a little bump called your tibial tubercle. That is where your quad muscle, which we'll get into shortly, your quad muscle comes down and attaches into your patella, and then there's a little ligament that attaches to that tibial tubercle. So ultimately that's where your quadricep muscles end. So that's kind of an important bony landmark. If you move just north of that, and especially if you straighten your knee now, you should be able to feel the borders of your patella. If you grab a hold of your patella, you should be able to wiggle it a little bit side to side or up and down. particularly with your knee straight. If it's bent, it kind of gets locked into position. So this one you can do with your knee straight, but you can try wiggling it. I like to, again, take my fingers like this, wiggle it up and down, and wiggle it side to side. Okay, so that's your patella. The next body part that we're going to look at is your greater trochanter. So if you place your hands right by your sides, welcome the cats. If you place your hands right by your sides and you palpate kind of up the side of the hip, the widest point is your greater trochanter. Same thing on the other side. So coming from down, palpating up, and you should feel that widest part there. So it's not your pelvis, it's on your femur, and it should be the widest part of you down there. Okay, so that's your greater trochanter. So when we're talking about shifting your trochanter, that's what that means. Next, we're going to palpate a couple parts of the pelvis. So you can place your hands kind of on the front of your pelvis here. The ASIS, or anterior superior iliac spine. If you place your hands right on top of your hips, that's your iliac crest. And then come forward, you should feel kind of two bony spots, right about equal on either side. So that's the anterior, ASIS, anterior meaning the front of the body. And then your PSIS, if you bring your hands back up on top of your iliac crest, and we follow them backward, you should again find two bony spots in the back. They kind of poke out. Sometimes they're a little bit tender. That is your PSIS, or posterior superior iliac spine. Anterior in the front of the body, posterior on the back. Next, we'll look at our ischial tuberosity. This one's pretty easy for you to find on your own. If you are palpating it on someone else, I highly recommend using the palm of your hand. Do not use your fingers. Use the palm of your hand because it's a sensitive area. Okay, always ask permission. Consent is key. So one way you can find this is simply by sitting. Our sit bones are ischial tuberosities, so you should be able to feel them kind of poking on the bottom. You can also find it if you run your hand straight up the back. It's the bony spot that's right underneath your buttock. So it's right in there. You have to push kind of firmly to get up in there. That is your ischial tuberosity. As far as your spinous processes go, those are the easiest to feel of your spine. If you've got shoulder issues, I recommend either palpating up high or down very low, not trying to get to your mid-back. So you'll go right for the very center of your spine, and you can kind of palpate running your fingers up and down. You should feel those little bony prominences right along your spine, and those are your spinous processes. Those ones are the easiest to kind of find on your own, as the ones straight down the middle of your spine. Our radial head is kind of fun to feel. So on the thumb side of your arm, your radius is on the thumb side, ulna is on the pinky side. The radial side of your arm, if you come all the way up to your elbow, just below the crease of your elbow, and I like to palpate with one or two fingers. Holding that hand still, you're going to then rotate your forearm, and you should feel that radial head spin under your fingers. So that's the one that it stays still, but it spins in place. So you'll feel it kind of spin under your fingers. Next is our clavicle. So it's our collarbone. Again, it's pretty easy to palpate on your own. You can find the borders of it. It runs from your sternum, so that little notch in the middle, all the way out to your shoulder. So you should be able to palpate that whole length of your clavicle, and on both sides. You may feel differences from your right to your left, so go ahead and palpate both and see if you feel a difference if one of them feels elevated versus the other, but you might feel a little bit difference there. The last one we're going to palpate for bone is our occiput. So we've heard occiput from a few of our dance professors potentially before. So your occiput is the back of the head. Specifically, we're looking at the nuchal line. So if you take your thumbs, let me angle myself upward a little bit. If you take your thumbs on the back of your head, back here, so you can do it with both of them, and run kind of from south to north, from inferior to superior, you should hit a ridge on the back of your skull. that is your nuchal line. So I'm doing it with both my thumbs all the way up to that ridge. That is your nuchal line. Again, that becomes important later when we start to talk about some different muscles and ligaments, because most of our bony prominences, the ridges that we feel, are where muscles and ligaments attach, or our tendons. So this is why it's important to find those little bony prominences first, because then it tells us exactly where our ligaments, our tendons, and our muscles are located. All right, well, let's head on to another body tissue. So our next body tissue is muscle to palpate. This one is another kind of easy thing to palpate because, as we learned in the earlier part of the lecture during the chicken dissection, is that muscles are contractile. So if you are having a hard time finding your muscle, all you need to do is contract it, and the muscle belly will pop into your hand. So for instance, the very first one on our list is our bicep. Bicep runs on the anterior part of the arm, so the palm side of your arm. If you give yourself a little resistance, pretend like you are lifting a heavy weight, you will feel it pop up underneath your fingers. Now there's a few different bicep muscles in there, but they all essentially assist with elbow flexion. So you should be able to palpate them kind of all contract under your fingers. Another really easy one to feel on your own are our wrist extensors and wrist flexors. So we call them common flexors, common extensors. There are a bunch of them. We want to palpate them as a whole because it's going to be difficult to kind of differentiate which one exactly is which if you're not really skilled at palpation. So we're going to palpate the muscle belly is up towards the elbow. Your tendons then reach down a little bit more toward here. So we want to feel the muscle belly to feel the muscle. So I'm going to place my hand right over top of, this is sort of the back of my dorsal side of my hand. Okay, and then you're going to just raise your fist up, and you should feel that muscle pop right into your hand. Similarly, if we flip the arm over, so now I've got my palm side up, again, you're going to palpate up close to the elbow. This time we're going to bring our fist upward, and you should be able to palpate near the medial side of your elbow, so the pinky side. You'll be able to palpate those muscles flexing. Yeah? So over on the elbow side. Next we've got our quadriceps and our hamstrings. So I'm going to go ahead and lay down for that. So your quadriceps are pretty easy to palpate. They're on the front of our thigh. And all you've got to do is pretend you've got a towel underneath your knee, and you're going to squeeze to squash it flat, and you should feel that muscle, that group of muscles, bulk right up underneath your hand. There are 4 quadricep muscles, 3 of which lie underneath and 1 lies on top. And I'm sure that Kristen will be taking you through all of those details, but you should feel that muscle tense up right underneath your hand. So that's your quadriceps. Your hamstring's a little bit trickier. You can try it standing, you can try it laying, but as you stand up, okay, if you palpate right on the back of your leg, because that is where our hamstrings exist, and you bend your leg upward, you should, again, feel them sort of pop into your hand. Okay, so they're right on the back of the leg. If you lay on your stomach, you can also bend your leg up and palpate. It may be a little bit easier to reach that way. But same idea, that you're bending the leg, and you should feel them pop right underneath your hand. There are officially 3 hamstring muscles. 2 are on one side, 1 is on the other. And again, Kristen will be going through all of those details with you in the future. But think your hamstrings are a muscle group, and your quadriceps are a muscle group. So now we'll head to our perineal muscles. So there are perineal muscles and peroneal muscles. Perineal muscles are in our pelvic floor. We are not palpating those. Peroneal are on the outside of the lower leg. Okay, so I'm going to palpate with my hand. So not right on directly on the side of my leg, but I'm going to go just behind my fibula. So if you can feel where your fibula is, if you go just behind it, and then we're going to wing our foot. you should feel those muscles contract, particularly if you're down low. So kind of behind that lateral malleolus, come up just a little bit, and if you wing your foot, you should feel those muscles contract. Okay. So the last major muscle that we're going to palpate is your transverse abdominis. This is the deepest abdominal muscle. My favorite way to palpate is by laying down on your back with both knees bent. If you prefer to put a pillow under your knees or something like that, you can, but that way you can kind of relax your other muscles and really get into your transverse abdominis. So I'm going to go ahead and lay back. Okay. And my head will be cut off in some of these videos, but I want you guys to really be able to see what I'm doing. So if my head doesn't make it on camera, that's fine. So we're going to find your ASIS again. So that's that bony spot in the front that we felt earlier of your pelvis. Okay, and you're going to come just inside. So you're going to crawl your fingers toward each other and up just a smidge. And what we're going to do is we're going to give like a nice exhale, drawing your belly button down toward your spine. And you should feel that muscle pull away from your fingers. So it should sink down toward your spine. Exhale, drawing the belly button in. And you should feel it pull away from your fingers. If you feel it push into your fingers, you are activating more of your oblique muscles. We want the transverse abdominis, which is the deeper one, deeper than your obliques. So again, exhale, draw the belly button down towards your spine. You should feel that muscle pull away from your fingers. And relax. And again. Exhale, draw the belly button in. Good. And again, you should feel that muscle sinking down away from your fingers, not pushing up into your fingers. So very related to muscles, we're next going to be palpating our tendons. So again, a tendon connects the muscle to bone. So now that we have been able to feel where some of our muscles are, we should be able to trace those muscles right down to where we've got some tendons. So the first one we're going to start with is one of our most prominent, our Achilles tendon. Our Achilles tendon is actually made up of a couple muscles. So it's not just one, but you can easily find it on the back of your ankle. So when we're looking at our Achilles tendon, so it's this nice thick one right back here. And you should be able to grab it on either side. You might be able to wiggle it back and forth. Yeah. But that is our Achilles tendon, the big one in the back here. Okay. To palpate our hamstring tendons, I would palpate the ones that are distal. Those ones are easy to feel. And again, same thing that we did earlier, that you're bending the leg up. And you should be able to feel it's a nice tight band. So different from when we feel the muscle belly, we want to be in the middle of the thigh. When we feel for the tendon, because it connects us to bones, it's going to be down at the end. And you should be able to feel it when you bend your knee. You can kind of grab right a hold of it. So I'm above my knee and I'm on the outside. So you should be able to feel a tendon there. You can also feel it on the medial side, because like I said, there's two on one side and one on the other. So there's two big tendons that run back there. And you should be able to feel it right there as you bend that leg. So earlier we were contracting our quadricep muscle, and I mentioned that there is a tendon that connects the quadricep down to the patella, our kneecap. So when you contract that muscle, you should be able to feel above. So if you find your patella, go just north of it, and you do that contraction, you should be able to follow your kneecap and feel where that tendon is. So another fairly easy tendon to feel is your bicep tendon. So if you come down again on the palm side of your forearm, kind of right in the elbow crease, as you flex your elbow up, you should feel a nice thick tendon pop right into your fingers, right in the front there. Okay, so that one's a pretty easy one to feel. That is our distal bicep tendon, and it's a nice big thick one. That is of our biceps brachii. If you want to feel one of the proximal, there's a couple heads to this muscle. If you want to feel where the proximal one is, if you palpate right in the front of your shoulder, so I'm going to put my fingers there, I'm going to bend my elbow to about 90 degrees, and then I'm going to rotate my hand in and out, keeping my elbow right by my side. You should feel a couple ridges roll past your fingertips. Right in between those two ridges, so if I stop where I feel like I'm in the middle, where my fingers are in between the two ridges, that is where one of my bicep tendons lies. And you might be able to feel it move a little bit if you bend and extend, flex and extend your elbow. So that would be the proximal, or closer to the center of the body, versus distal, which is further from the center of the body, our proximal bicep tendon. A couple of others that are kind of easy to palpate and or see, we've got our anatomical snuff box. So if anybody knows what a snuff box is, it's where you put your tobacco that you would then inhale, or other illicit drugs, but we don't need to go there. But your anatomical snuff box, if you extend your thumb this way, you should see a couple of tendons pop out right along the side of your wrist, and that is where you would put whatever it is that you want to inhale. You can also easily palpate the tendons that run to your flexors and extensors of your wrist. If you just lie your hand right along the back of your wrist and extend the fingers, you should be able to feel them kind of sliding up and down, or in the back of your hand, you may feel them sliding up and down. Same thing if you rotate with your palm side up, palpating on your wrist, and you wiggle your fingers, you should feel those tendons kind of slide and move. You can also cup your fingers like so and kind of feel that tendon in each finger. Those ones are kind of easy to feel on your own. So the last tendon that I like to have students palpate is your flexor hallucis longus down in your ankle. So again, if you find your medial malleolus on the inside of your ankle, and if you put your thumbs just below it, just inferior and posterior to it, and you give a little squeeze, you should notice, and you might have to play around with the exact position, but you should notice your toe curling ever so slightly. So I will zoom in to show you that. So again, I have found my medial malleolus, the bony part. I go just posterior, and actually I'm going to go a little bit higher up than I originally said, but as I push in with my fingers, you'll notice my toe curl. And that is because I am pressing on the flexor hallucis longus tendon and applying some tension to it. Next, we'll be palpating some ligaments. Because ligaments attach bone to bone, often you cannot find them as much on the surface of your body where they're really palpable, so they're not very superficial, so they're harder to palpate. However, there's a couple of them that are a little bit easier to palpate, and those are the ones that we'll be doing. The first being your ligamentum nuchae. So earlier we found our nuchal line on our occiput, so right where that ridge is as you draw your thumbs up on the back of your skull. If you go just a little bit south of that, so kind of where the very base of your skull, and you slightly nod and extend, you should feel a tissue push into your thumbs, and that is your ligamentum nuchae. So it's a ligament that attaches in to your spinous processes and up into your skull, and creates some amount of stability back there for your head. And you should feel it kind of pop out as you flex and extend your head just slightly. So that's the ligamentum nuchae. Next, we're going to look at your MCL and your LCL. These ones can be palpated on the outside, but it's going to be much harder to actually feel what you're feeling. But if you find along either side of your knee, kind of right where the joint is, you can feel a couple bony spots, but it gets down where there's not as much flesh right over that area. And you can test it to make sure that you're there by flexing and extending your knee to make sure that you're right on the joint line, and your medial collateral ligament, MCL, should be right there. So right along the side. And again, you're not going to feel much as far as texture under your fingers because it's going to be really deep in there, and it's lying right along the bone. But say if you've injured your knee, you might find some tenderness in that area. And same thing on the outside, the lateral side of your knee. You can also palpate it right at that joint line, your LCL or lateral collateral ligament. The last ligament we're going to attempt palpating is your ATFL or anterior talofibular ligament. So we found the talar head earlier. Your talus is right inside the ankle. Your fibula is the bone on the outside of the lower leg. And this ligament is anterior, so it's front. So it's connecting your talus with your fibula, and it's on the front of the ankle. So it is right in here. So you can see if I go find my lateral malleolus and I go just anterior, you will find that ATFL right in there. And the way that you can kind of palpate it, just like you saw me doing, I put my fingers right over that spot. So lateral malleolus, I go just anterior, and then I'm going to supinate my foot or sickle my foot. And you'll just feel it. There's sort of like what we call an end point or an end feel, where it feels like you can't go any further. And that's when that ligament is on full tension. That ligament is the most often sprained in the ankle, the most often injured in the ankle when we have a supination ankle roll. So again, if you've got tenderness or a lot of swelling right over that area, and say you twisted your ankle or fell, that maybe you've injured that particular ligament. So next up, we are going to palpate our fascia. Fascia is really hard to palpate because if you recall from the chicken dissection, sometimes it can be super thin. In other areas, it can be really thick, but it's hard to kind of differentiate sometimes between that and muscle or tendon. So we're going to pick out a couple areas where it's a little bit easier to feel. So I'm actually going to skip down on our list. We're going to take a look at the IT band first because this one's fairly easy to palpate. So your IT band is a thicker area of fascia than some other areas of the body. So those of us with really good connective tissue will be able to feel it really easily. So if you run your hand down the side of your thigh, you should be able to feel that kind of fibrous sensation underneath your fingers, and that is your IT band. You may be able to find the edge of it, especially if you contract and find your quadricep muscle again. You'll kind of feel like you've gotten to the edge of your muscle, and that is where your IT band lies. So you can do it a couple of different ways, just by palpating or by contracting the quadricep muscle and try to find the borders of your IT band. The next kind of easy one to palpate is your plantar fascia. So plantar fascia meaning the plantar side of your foot. So your plantar fascia runs all the way from your heel to your toes, right at the kind of the base of your toes. So really palpating along there, you're going to be hitting some fascia, but if you want to feel it on tension, you will extend your toes and you should feel stuff kind of pop into your hand. Remembering that when we extend our toes, the muscle that's extending them is actually on the dorsal side of your foot. So if we're thinking about a muscle contraction, these should be bulking up, the muscle belly should be bulking up on the front of the foot or on the dorsal side of the foot. And so when we extend our toes, this is due to tension on that plantar fascia. You can also do it passively by just extending your toes with your fingers and feeling kind of how that tissue has tightened on the bottom of your foot. The last area that we're going to palpate, and this is a little bit more fun to do with a friend, but we'll do it on ourselves, for trying to stay out of contact with other people, unless you've got somebody that's really close to you that you're already living with and not wearing a mask around. But what we're going to do is we're going to take both of our hands. We're using a flat hand technique. And all I want you to do is very gently, we're going to try to almost pretend like we're taking our quadricep muscle, and we're going to try to roll it over our leg. So you're not rolling the leg with you, you're just kind of putting a little tension on the skin. And then you should feel, as you kind of create that pull, that there's a sensation that your muscle wants to put itself back in place. So meaning that as you pull, there's some resistance. And that resistance is because of our fascia. Yeah, so you can kind of feel as you pull one way, it feels like it wants to go back to where it started. Same thing if you roll the other way. You'll feel that tension that it's pulling you back to its original location. And that is because of the fascia. So even though I'm not touching and feeling with my fingers what fascia feels like, I know that it's there because it is creating that structure and telling me the place that that muscle is supposed to be in. So that's another way to kind of palpate fascia. Okay, as far as nerves are concerned with palpation, you're not necessarily going to be able to palpate certain nerves very well. Now, our biggest peripheral nerve, meaning not down our spinal cord, but the nerves that come out of it, our biggest peripheral nerve is our sciatic nerve. It runs down the back of your leg, and you can find it right dead center in the middle of your butt cheek. You can try to push in there yourself. If you have a friend or you want to try it on a friend, you can. Be careful because sometimes it can be pretty tender up in there. But really the way that we find our sciatic nerve is by applying tension to it. So like I said earlier in the dissection portion, is that our nerves don't really stretch a whole lot. They stretch a little bit, and you can pull on them, but it creates that same, almost a similar sensation to stretching a muscle. So here's how we find our sciatic nerve. We'll sit in a long sitting position and just go ahead and relax your ankles so I don't have them pointed or flexed or anything. They're just relaxed. And you're going to reach forward like you're trying to touch your toes. And go down as far as you can. Once you are down there, most of us should be able to reach pretty far. What you're going to do is you're going to flex your feet. So I will show you. I'm going to bend all the way forward. Once I get there, I should be able to go pretty far. You're going to attempt flexing your feet. You will notice that there is extra tension as you flex your feet. So as you dorsiflex your feet, you should feel extra tension coming usually up through the hamstrings, but sometimes through the calves. There is no one muscle that goes from your feet to your hips. There are multiple muscles that sort of start at the ankle, end at the knee, start at the knee, end at the hip, but there's no one muscle. So the thing that creates tension when we stretch all of it can either be nerve or fascia, because nerve and fascia runs that whole length. Generally speaking, when we think that we've got really tight hamstrings, it's actually tension from our sciatic nerve and not the hamstring. So yeah, you should be able to flex all the way forward, and then as you dorsiflex your feet or flex your feet, you should feel that extra tension running up the back of your leg, and that is your sciatic nerve. Another easy nerve to find is our ulnar nerve. This is your funny bone. So if we go on the pinky side of the forearm, right at our elbow, there's a little notch that you can feel to the side of your elbow. And if you tap on it, sometimes you can get a little numbness down into your finger. That is your ulnar nerve. That's why when we hit it, we get that kind of zinging sensation, and sometimes it'll cause numbness tingling down into our hand, because that's a nerve. So it's not actually a bone. Funny bone is not a bone, it's a nerve. So that's a pretty easy one to find. Similarly, we can find our median, ulnar, and radial nerves in our upper extremity, similarly to how we found the sciatic nerve. So if we stand and you place your hand like so on your shoulder, we are then going to extend our arm all the way out with a flat hand, and you should feel some of that tension out in our hand. Similarly to the lower extremity, there's no one muscle that runs the whole length of our arm. So the only thing creating that tension can be nerve or fascia. Particularly if you feel numbness starting in your hand, then you definitely know that it's nerve. So that's to find your median nerve. To find your ulnar nerve, you can try to make the goggles, if you've ever done that in the past, or pretend to scratch behind your ear. And you should feel some tension along kind of the pinky side of the hand or forearm. only go as far as you feel comfortable. If you feel a lot of tension and you haven't gotten there yet, that's plenty. It means that you've got a little more tension in your nerves than some other people. So don't push it, because you can cause irritation in those. But yeah, you could make the little goggles where you plant it on the side of your face. And last, to the radial nerve, what you do is you make a fist, extend your arm right by your side. They call this one the waiter's tip. And you ask for a tip behind your back. This one will create a little bit of like a tension feeling through kind of where the anatomical snuff box is on the thumb side of the hand. So you may feel some tension there. I find the fewest people usually have a lot of tension in this position. We usually have a lot more tension with the median or ulnar nerves. But you can try that out and see how those feel to you. And that will tell you if you've got tension in your nerves. Again, they're harder to kind of palpate underneath the skin because most of them aren't right out on the outside. But we can tell which one might be involved just by changing our position a little bit. As far as palpating our joint capsule, were we to have partners, I would be demonstrating a couple of other joints, but simply because we're trying to reduce contact with other humans, I have chosen to just focus on the phalanges, or your fingers or toes. So you can do either fingers or toes, depending on what you want to work with, but you can easily palpate your joint capsule by taking a hold of, so this bone in your finger, not this bone and not the next bone up, but this one, between your first knuckle and second. And you're going to grab a hold of it, and you're going to try to wiggle that bone up, straight up and down. So you're not trying to extend and flex the finger. You are moving that bone straight up and down. And you should feel a little bit of wiggle right in the actual joint itself. And that is that little thing that kind of stops the movement. That is our joint capsule. So you can feel how much play you have in your joint capsules. And you can go one finger and then the next and the next. And you'll kind of see how it moves. Our fingers are pretty flexible, so you don't have to push a whole lot on them to get that movement. And like I said, you're going straight up and down. You're not extending and flexing. You are pushing straight up and straight down. And you'll see that little bit of play in my joint. Yeah? So that's your joint capsule. We are getting towards the end of the palpation. Bear with me. So next we're going to look at some different areas of cartilage. And like I said, cartilage tends to be between joints, in the middle of joints, some of the thicker stuff anyway. So it's, again, hard to palpate because we would need to be inside of the joint to feel it. So some of the areas that I like to feel, just to feel for the texture of it, is to feel your ears, which again are cartilage, but it's got that kind of firm but pliable feeling to it. Our nose, so the tip of our nose, not the whole nose, this will be bone, but the tip of our nose is cartilage, so you can feel how pliable it is. And then our thyroid area. So down in this area, especially on gentlemen, they have that nice Adam's apple. That is cartilage. And you can sort of feel what that feels like right around where our voice box is. You can also take a hold of your actual throat and wiggle it side to side, which is kind of fun and kind of weird. But you might be able to feel a little kind of like graveliness behind. And that is more cartilage. Yeah, so try that out. Wiggle your windpipe around a little. The very last thing that we're going to palpate are some blood vessels. So there are some areas where it's a little bit easier to do this. And again, because if you palpate over a blood vessel and push on it, you can kind of squish it pretty easily, that we're not going to go in with a deep pressure, but we're going to instead feel for our pulse. That way we know where we are. So you can obviously see blood vessels sometimes on yourself. So that's a good way of kind of knowing where they are, but they're hard to feel because, like I said, you kind of squash them when you push on them. But you can find your carotid pulse. So your carotid artery is the one that's up in our neck. So to find this one, we try to find our sternocleidomastoid. So if you rotate your head, you'll feel that big muscle that sticks out. You're going to put your fingers right near that, and then you're going to slide down underneath your jaw a little more. So I'm in front of that muscle, kind of right in by my jaw. And everybody's a little bit different with exactly where it's placed, so you might need to move your fingers around a little bit, but you should be able to feel a nice strong pulse up there. And always using 2 fingers, not your thumb. Your thumb has its own pulse, so try always with 2 fingers. You can kind of play around, like I said, and find where you can feel it. Okay, but you should be able to feel a nice strong pulse up in that area. Okay, the next place we're going to look is our radial pulse. Radial meaning down in the arm. So when we're looking for our radial pulse, we go right on the end of the wrist on the palm side of the hand. Again, using a 2-finger technique. And you're not right in the middle, but you're a little bit towards the thumb side or the radial side of your hand, hence the radial pulse. And you should be able to feel a nice strong pulse in there. So when you're exercising and you want to check your pulse, those are the 2 most common areas to kind of check it at. It's the radial and the carotid. Just be mindful that when you're searching for your carotid artery that you try not to do both sides at once, because if you're compressing too much, you can make yourself pass out. So always just try one side at a time. The very last pulse that we can feel for is your pedal pulse. Pedal stands for foot. So if you take a seat again, you should be able to find your pedal pulse on the dorsal side of your foot, kind of more towards the pinky side, and up toward your ankle, so up in this area. So I'll show you on my other foot as well. So the lateral side of the foot, below that lateral malleolus, but not all the way down by your toes. So it should be kind of along the side of the foot there. And again, always using your 2-finger technique to feel for a pulse. So that concludes this lecture for today on body tissues and palpation. You are always welcome to contact me if you have any questions about any of what I went over today, or if you have other questions either about injuries or different body tissues. My email is gneslund, Neslund, @umich.edu, and I will give that information to Kristen. And as far as assignments, Kristen is in charge of all of that, so make sure that you check in with your Canvas to make sure that you are completing assignments as posted. Other than that, enjoy. And I have included as well a couple of recipes so you can use that chicken if you did indeed purchase a whole chicken. Otherwise, I will see hopefully you guys next semester. Bye.